So here we're going to show the side-lying bicep stretching technique. First thing I like to do is have the client come backwards on the table towards me. That just prevents me from having to lean over so much. The great position about the side-lying with this particular technique, it allows us to manipulate the amount of ad and abduction and rotation of the lower arm and indeed the upper arm. And this all affects the bicep area and forearm. The bicep is in the tight line of Yarmouth's upper cross syndrome, so it's generally very short and tight. The biceps are also very weak, especially when the shoulders are extended. So when the shoulders are extended, this puts the bicep on stretch, and most people, athletic populations and non-athletic populations, don't have any capacity to engage their biceps and indeed their triceps, the antagonistic tissue. So we need to restore bicep length, but really we're looking at shoulder extension. So we need to restore shoulder extension. And if someone's got tightness in the biceps, they're gonna have limited extension. And what they'll tend to do, if I stretch Kiki here, people tend to protract this way when they stretch, and you'll see that a lot in the gym environment when people are doing things like dips, bench press, for example, they protract. And those are the people who come to us with anterior shoulder pain and upper thoracic pain also from the poor scapular position when doing certain exercises. So the key thing is with this technique, clients on the back of the table facing me, I do this handshake grip, and I just hold Kiki's hand with two fingers free here. I brace the shoulder, and my intention is not to let her protract. So I take up the shoulder extension till we feel resistance, and we can just hold. We're going to hold for 5 in this case. Then we take the stretch off, a little shake, and we go to the new resistance barrier. I don't want to go crazy and pull too hard, too fast. So we're going to show this from a couple of different angles so you can see my body mechanics also. So now, as I stretch, a common mistake we see in class a lot is people when they stretch, they end up coming up here, and this tends to really open up the shoulder joint. And we're trying to keep the shoulder internally rotated, and that keeps the bicep in the bicipital groove. So we don't want to come up and out like so. We want to be level with the horizon and even a little bit below this way. That feels like a deeper stretch. So now what we're going to do, as we stretch, I'm preventing too much motion in the shoulder. I tap Kiki's wrist and I say push into me here. So here she's activating the biceps and the whole anterior upper arm. She relaxes, I take up the slack. Push, 1, 2, 3, relax. Push. Good. So this hand, I'm holding, but I'm not pushing. I don't want her to protract too much. I want her to stay ideally stationary. And push. 1, 2. Kiki's got good range of motion here. Most of our clients, when they get to like 45 degrees, they're gonna be very limited. And when you ask them to push, there's gonna be a moment when they have to think what that means, because they just have no practice, no awareness of having their shoulder back here. So in the real world, it's gonna look like when I'm here, I'm gonna say push, and it's gonna take a few seconds for the client to push. So that's when you start tapping and say push, push, and give them some proprioceptive cueing. Here. Let's turn the other way, Kiki, facing away from the camera. So I'll show you from this angle. So I take the hand, this grip here. I step around, and I use my body, and I step back here. Notice from this angle, guys, I'm keeping her wrist pretty straight. See how her wrist is straight? So I'm holding her wrist like so. Another common mistake we see is people coming too high and people really cocking the wrist back here. This ain't necessarily a bad thing if you're doing it for a very specific reason. This becomes very neural. This becomes very strong neural stretch. Most of you guys are probably familiar with the straight leg raise stretch, when you plantar and dorsiflex the ankle and or the head to create a neural glide or a neural tension. It's the same here. This is called an upper limb nerve test, although we're not doing a nerve test. So sometimes what you'll see people doing is they stretch and they start doing this, and the client says, yeah, I feel that burning in my forearm, or I feel this in my neck. What we are trying to do is achieve shoulder extension, so we relieve the tension and we keep the wrist straight. We stretch, we push, 1, 2, 3. So the bicep is a great technique to add into your sideline. You don't have to hold my hand. It's a great technique to add into your sideline routine. Very easy to feed in, and it's a very underworked area. So get used to opening up people's shoulders. We say this in our seminars a lot. People get hurt doing nothing. So what we mean by that is that they're reaching behind themselves to grab their coffee when in the car, or they go to reach their seatbelt, or they go to scratch their back. This is all shoulder extension, and it's very commonly lost in our sedentary population. So this is a great way to restore it under control. So add this one into your recipe and let us know how it goes.